15 signs of bowel cancer and 8 ways to avoid it. In this video, we will explore a crucial topic for our health: bowel cancer. This often silent condition manifests through symptoms that many of us may neglect. But do you know which changes in your body could indicate a risk? Let's dive into some common signs, yet few people are aware of. Could minor changes in your body be an alert to something more serious? Throughout this video, we will not only discuss these warning signs, but also address some preventive measures so that you are never affected by this disease. And do you know the most effective strategies to prevent bowel cancer? Did you know that small details could be the difference between life and death? Stay until the end to discover essential answers to protect your health and well-being. Let's get started. 15 signs of bowel cancer and 8 ways to avoid it. Changes in bowel habits. Changes in bowel habits represent one of the most common early signs of bowel cancer, alerting to possible abnormalities in the digestive tract. These changes include persistent experiences of diarrhea or constipation, in addition to variations in the consistency of the stool, which may indicate obstructions or changes in intestinal functionality caused by the growth of a tumor. Cancer can interfere with the normal processing of waste by the body, leading to notable changes in the frequency and shape of bowel movements. It's crucial to pay attention to any change that persists for more than a few weeks, as while occasional fluctuations in bowel habits are normal, enduring variations may be indicative of more serious conditions, requiring medical evaluation to rule out or confirm the presence of colorectal cancer. Rectal bleeding or blood in the stool. The presence of blood in the stool is an alarming symptom that may indicate bowel cancer. This sign can manifest in various ways, from bright red blood visible on toilet paper to stools with a darker coloration, suggesting digested blood. Bleeding can result from irritation or damage caused by tumors in the lining of the bowel or rectum, which bleed when stools pass. Although there may be other less serious causes for bleeding, such as hemorrhoids or anal fissures, it is vital that this symptom is not ignored. Early detection and investigation are crucial, as rectal bleeding can be one of the first indicators of colorectal cancer. 3. Feeling that the bowel does not empty completely. The feeling of not being able to completely empty the bowel after evacuation is a symptom reported by many patients with bowel cancer. This feeling can be particularly frustrating and uncomfortable, suggesting that the bowel still contains feces even after the person tries to evacuate. This sensation often results from the presence of a tumor in the colon or rectum, which may partially obstruct the normal path of the feces. Creating the impression that the bowel has not been fully emptied, the tumor can interfere with the bowel's ability to function correctly, affecting the signals that indicate when the bowel is empty. Pain or abdominal discomfort. Persistent abdominal pain or discomfort can be an indicator of bowel cancer. This symptom arises when tumors grow enough to cause obstructions or inflammation in the bowel, resulting in significant discomfort. As the tumor advances, it may press on surrounding organs or distend the bowel, leading to sensations of pain, cramps, or bloating. This type of discomfort can vary in intensity from mild to severe, and often is not completely relieved by dietary changes or the use of common pain medications. Continuous abdominal pain, especially if accompanied by other symptoms such as changes in bowel habits or weight loss, is a warning sign that should not be ignored. Feeling of bloating or the presence of an abdominal mass. The feeling of bloating or the presence of an abdominal mass can be a concerning sign, potentially indicative of bowel cancer in more advanced stages. When a tumor in the bowel grows to the point of being palpable, or when it causes a significant accumulation of gases or fluids in the abdomen, patients may notice a visible increase or a sensation of fullness in the abdominal region. This symptom may be accompanied by discomfort or pain, reflecting the pressure exerted by the tumor mass on the internal organs and surrounding structures. Although not all swellings or masses are cancerous, the detection of any palpable abnormality in the abdomen should be immediately evaluated by a healthcare professional. Unexplained weight loss. Unexplained weight loss is often a warning sign for various health conditions, including bowel cancer. When there is no intentional change in diet or physical activity level, weight loss may indicate that the body is not absorbing nutrients properly or that it is using more energy due to the growth of a tumor. In the context of bowel cancer, the tumor can interfere with the intestine's ability to process and absorb nutrients, or provoke a systemic response that increases the body's metabolism. Additionally, the patient's appetite may be affected, reducing caloric intake. This symptom is particularly concerning when it occurs rapidly and without explanation. Extreme fatigue or unexplained weakness. Extreme fatigue or unexplained weakness, especially when persistent and not relieved by rest, can be an early sign of bowel cancer. These symptoms may result from a combination of factors associated with cancer, including a reduction in the body's ability to absorb nutrients due to tumors affecting the intestine. Moreover, the presence of cancer in the body can lead to a chronic inflammatory response, consuming a significant amount of the body's energy and contributing to the sensation of tiredness and weakness. Anemia, a condition often caused by hidden blood loss in the stool due to bowel cancer, can also contribute to fatigue, as the body has fewer red blood cells to transport oxygen to tissues, exacerbating the sensation of tiredness. 8. Anemia. Anemia caused by chronic blood loss in the stool, often not visible to the naked eye, is a common and significant symptom of bowel cancer. This slow but steady blood loss can gradually reduce the number of red blood cells in the body, leading to a decrease in the blood's oxygen-carrying capacity. As a result, patients may experience symptoms such as paleness, generalized fatigue, weakness, and, in more severe cases, shortness of breath and dizziness. Anemia resulting from this hidden blood loss is particularly insidious, as it can develop slowly, allowing the cancer to advance undetected for prolonged periods. It is crucial that any suspicion of anemia be investigated by a doctor through blood tests and, if necessary, additional tests to identify the underlying cause. Early diagnosis of bowel cancer, often revealed by the investigation of anemia, can significantly increase the chances of successful treatment. 9. Narrower than normal stools. Narrower than normal stools can be an intriguing symptom, often underestimated, of bowel cancer. This peculiar sign occurs when a tumor in the colon or rectum begins to partially obstruct the normal path of the stool, forcing it to shape more thinly to pass through the narrowed area. While changes in diet or other intestinal conditions can also result in changes in the shape of the stool, the persistence of narrow stools, especially if accompanied by other symptoms such as bleeding or abdominal pain, requires medical attention. This symptom suggests that the tumor has reached a significant size to impact the normal passage of stools, highlighting the importance of early diagnosis. Appropriate investigation, including imaging tests and colonoscopy, can identify the exact cause and allow for effective treatment, increasing the chances of a positive outcome. 10. Vomiting. Vomiting may not be the first symptom that comes to mind when thinking of bowel cancer, but in cases where the tumor causes a significant blockage in the gastrointestinal tract, this symptom can become evident. The blockage prevents the normal passage of content through the intestine, leading to the accumulation of undigested food, gases, and liquids. This accumulation creates pressure, discomfort, and eventually vomiting as the body's attempt to relieve the obstruction. Vomiting, especially if accompanied by other signs such as intense abdominal pain, changes in bowel habits, and weight loss, requires immediate medical attention. This symptom may indicate an advanced stage of the disease. 11. Difficulty or pain. When defecating. Difficulty or pain when defecating is a common symptom that can be a warning sign for bowel cancer. This discomfort may arise when a tumor is located in such a way that it affects the normal passage of stools, causing partial or total obstruction. As the stools attempt to pass through the affected area, the effort can be painful, and the passage of stools can become extremely difficult. Additionally, if the tumor is near the anus, the pain may be exacerbated during bowel movements. This symptom, especially if accompanied by rectal bleeding or changes in bowel habits, should be investigated without delay. 12. Increased need to defecate without relief after doing so. The increased need to defecate without feeling relief after doing so is a disconcerting symptom that may indicate the presence of bowel cancer. This constant, yet fruitless, urgency to defecate often stems from a tumor pressing on the inside of the colon or rectum, creating the misleading sensation that the bowel is still full. Besides being physically uncomfortable, this condition can be psychologically stressful, significantly impacting the individual's quality of life. 13. Loss of appetite. Loss of appetite is a symptom that may initially go unnoticed, but in the context of bowel cancer, it can be an important indicator of the disease. Tumors in the intestine can secrete substances that negatively affect metabolism and alter hunger mechanisms, leading to a decreased desire to eat. Furthermore, the presence of a tumor can cause discomfort or pain after eating, which may lead the patient to avoid eating to minimize these symptoms. Prolonged loss of appetite can result in significant weight loss and malnutrition, further compromising the patient's health and their ability to fight the disease. 14. Bloating or gas buildup. In the abdomen, bloating or gas buildup in the abdomen is a symptom that, while it can be common in various digestive conditions, in the context of bowel cancer, may indicate a more serious problem. This symptom occurs when a tumor in the intestine hinders the normal passage of gas or causes a partial obstruction, leading to the accumulation of gases and causing significant abdominal discomfort. In addition to the sensation of bloating, the patient may experience pain and abdominal distension, which can worsen after meals. This buildup of gas not only causes physical discomfort, but can also affect the patient's quality of life, limiting their daily activities. 15. Discomfort or pain. In the rectum, discomfort or pain in the rectum is a symptom that can be particularly indicative of cancer in the rectum or in the area nearby. This discomfort can manifest in various ways, including pain during or after defecation, a constant sensation of pressure, or the presence of continuous discomfort in the rectal area. This symptom may result from a tumor growing inside or around the rectum, causing inflammation, obstruction, or even invasion of the local tissues, which can significantly affect the normal function of the rectum and cause pain. Moreover, the presence of rectal bleeding can exacerbate the sensation of discomfort, making defecations particularly painful. Each of these symptoms can have benign causes, but the presence of one or more of them, especially if they persist or worsen, justifies a medical consultation for a careful evaluation. Early diagnosis is crucial in the effective treatment of bowel cancer, significantly increasing the chances of successful treatment. How to prevent bowel cancer? Preventing bowel cancer involves adopting a healthy lifestyle and paying attention to screening recommendations. Here are some strategies to reduce the risk of developing bowel cancer. 1. Healthy diet. Consume plenty of fruits, vegetables, and whole grains. Diets high in fiber have been linked to a lower risk of bowel cancer. Limiting the intake of red and processed meats can also reduce the risk. 2. Maintain a healthy weight. Being overweight or obese can increase the risk of bowel cancer. Maintaining a healthy weight through diet and exercise can help reduce the risk. 3. Regular exercise. Regular physical activity can help reduce the risk of bowel cancer. Try to include at least 30 minutes of moderate activity on most days of the week. 4. Don't smoke. Smoking is associated with an increased risk of many types of cancer, including bowel cancer. Quitting smoking can reduce the risk. 5. Limit alcohol. Excessive alcohol consumption has been linked to a higher risk of bowel cancer. Limiting alcohol intake can help reduce the risk. 6. Screening. Participating in bowel cancer screening programs is one of the most effective ways to prevent bowel cancer or detect it early when it is more treatable. Screening tests can identify precancerous polyps so they can be removed before they become cancerous. 7. Avoid toxic exposures. Limiting exposure to radiation and industrial chemicals can reduce the risk. 8. Know your family risk. If you have a family history of bowel cancer, intestinal polyps, or other genetic conditions that increase the risk, talk to your doctor about when to start screening and which tests are best for you. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.